Disseminated Coccidioidomycosis by Aaron Birch, OMS 3, Dr. Santisteban Sosa, and Dr. Faze. Coccidioidomycosis is a subtype of systemic mycosis that causes vague pneumonia-like symptoms as well as meningeal symptoms. The broad spectrum of symptoms and the disease's inconspicuous presentation commonly leads to diagnostic difficulties. The fungus Coccidioides immitis is responsible for coccidioidomycosis, also called valley fever. It is endemic to the southwestern United States and lives in soil. For an immunocompetent individual, symptoms are mild and localized to the lungs, but the fungus can disseminate to the skin, bone, and brain in an immunocompromised patient. For our case, a 68-year-old female presented to the hospital complaining of a headache for 10 days. The patient's headache progressively worsened and was associated with fever, chills, nausea, non-bilious emesis, and the inability to tolerate food. This led to generalized weakness and exhaustion. She was self-medicating with NSAIDs, hydrocodone, and muscle relaxers with minimal relief. She has a past medical history of herpes simplex virus and takes her husband's acyclovir for associated flares. In obtaining a social history, the patient disclosed that 4 months prior to her admission, she traveled to Sedona, Arizona, the Grand Canyon, Central America, and multiple trips abroad, and subsequently developed pneumonia. Upon her return, she was treated by her primary care physician and pulmonologist with antibiotics and a steroid taper for suspected pneumonia and bronchitis. The patient failed to improve clinically, thus imaging was indicated. CT of the chest was abnormal, and due to her persistent cough and abnormal CT image findings, the pulmonologist decided to move forward with bronchoscopy as there was concern for lung cancer. Subsequently, cancer was ruled out, and the results of the bronchoscopy showed this process related to coccidioidomycosis. Her initial workup on admission included the following: CT of the head without contrast, CT of the thorax, CBC, lumbar puncture, CSF studies, culture, gram stain, serology for HIV, VDRL, histoplasmosis, urine antigen, and serum fungal acid-fast bacillus. All studies were unremarkable or negative except CT of the thorax, which demonstrated interstitial right upper lobe pneumonia with pulmonary micronodules as moderate mediastinal adenopathy, and CSF studies and lumbar puncture demonstrated low glucose, elevated WBCs, and elevated eosinophils, mostly consistent with fungal etiology. For figure 1 on the left, this is the patient's CT thorax demonstrating interstitial right upper lobe pneumonia, the pulmonary micronodules, and moderate mediastinal adenopathy. In figure 2 on the right is a classic picture of a spherule containing multiple endospores. There are approximately 150,000 cases of coccidioidomycosis per year in the United States. Overall, a majority of cases are asymptomatic or have mild symptoms. Diagnosis can be made by history. It's important to ask about recent travel, especially to endemic regions. Various tests can be performed, such as serologic testing for IgM and IgG, fungal cultures, sputum examination with KOH prep, and bronchoalveolar lavage. Treatment depends on disease severity. Options range from nothing to oral fluconazole to IV amphotericin B. The patient's serologic findings and clinical picture was consistent with the diagnosis of disseminated coccidioidomycosis associated meningitis. An infectious disease specialist was consulted, and the patient was initially treated with oral fluconazole, then ID changed oral fluconazole to IV fluconazole and added IV liposomal amphotericin B. Upon discharge, the patient was transitioned to oral fluconazole 400 milligrams BID. This case demonstrates the presentation of disseminated coccidioidomycosis associated meningitis with pulmonary involvement. It is a diagnosis that is often overlooked and not included on one's differential due to not taking a thorough history or asking about recent travel. Recognition of these pulmonary neurological symptoms is critically important in making a diagnosis of coccidioidomycosis and other mycosis. Thank you.